Greetings to all. I am Dr. Sadiqua Anjum, DM Neonatology resident from Niloufer Hospital for Women and Children, Hyderabad, India. I am presenting our work on a quality improvement initiative in improving and sustaining the rate of early initiation of breastfeeding, that is within first 1 hour of birth. Our hospital is a 1,000-bedded tertiary level government college hospital with almost 12,000 to 14,000 deliveries being conducted per year. Our hospital also had the opportunity of being the training center for the QI project, catering to various government and private newborn units under the guidance of UNICEF. And this was the picture of the initial QI training program. So this QI was undertaken to reap the various benefits of early initiation of breastfeeding given the lower current rates. This was the global statistics. So delay in breastfeeding would increase the neonatal mortality rate. And so the QI team was formulated. And the aim statement was to increase the early initiation of breastfeeding from the baseline of 16.5% to 70% over a period of 1 month. And the problem indicator was number of babies who were breastfed within the first 1 hour, a total number of live healthy babies born in our hospital over a given period of time. So the problem analysis was done using the fishbone. And fishbone had shown that the patients and the attendants were not aware about the early initiation of breastfeeding, the lactation counselors were not sufficient, the health staff was busy to help the mother, and the policy was not in place, and then the stretcher on which the mother would lie after delivery was very narrow to support the baby for feeding, and then the baby would be separated from the mother for recording of weight and footprints. And 80% of the problems were found to be due to lack of awareness and lack of policy. The following 8 ideas were formulated after meeting, and then we were ready to get started. We would record the data over a period of 1 week and then discuss with the team members every week. We had formulated 6 PDSC cycles. The first PDSC was sensitization of the team members, and this improved the breastfeeding to 31.5%. This way the meetings. The second one was a documented antenatal counseling regarding the early initiation of breastfeeding and the need of a dedicated birth companion. This improved the breastfeeding to 40%. These were the cards used. The third cycle was documented peripartal counseling involving the birth companion, and this improved the feeding to 51%. These were the cards used. The fourth PDSC was the use of a unique stamp which was designed and using the signature of the birth companion, and this improved the feeding to 69.23%. This was the stamp which would be placed in the front of the mother's file, and it would be signed by the birth companion testifying that breastfeeding was started within first 1 hour. The next cycle was use of IEC material, information, education and communication material at different places, and this improved the breastfeeding to 73.68%. This is the material used in the postnatal ward in different languages for parents to understand. This one in front of the labor room as well as OT to show the importance of birth companion, the roles and responsibilities in different languages again. This is in the labor room where mother would see. The next cycle was introduction of a dedicated column for breastfeeding initiation and progression in newborn sheet prior to discharge and follow-up card after discharge of the newborn. This improved the breastfeeding to 82.3%. So these were the columns added. The left one prior to the discharge of the baby, the right one after the discharge of the baby. It would tell us about the early initiation of breastfeeding and the issues related to breastfeeding. The baby has been breastfed in the first 1 hour of life. The run chart has shown that during the intervention phase, we have reached up to 82.3%, and during the maintenance phase, we have maintained almost the same level, except after the onset of COVID pandemic, it has dipped up to 70%, and then it came back after 4 weeks to 76%. This run chart shows the compliance in the vaginal birth and the cesarean births. The cesarean birth compliance was always lower as compared to vaginal births. We did face a lot of challenges, like the birth companion kept changing. Entry of male birth companion in the labor room was objected by other patients. Entry of birth companion in the OT complex recovery room was an issue when too many sections would happen. And then the stretcher on which the mother would lie was still the same. We were facing the same problem. And then counseling and adherence to early initiation of breastfeeding during COVID-19 pandemic got difficult with the changing quotations of the healthcare workers and doctors. So we felt like we've reached the finish line, but because of the challenges, we feel that we're still racing. This was the early initiation of breastfeeding with the birth companion helping the mother after the onset of COVID-19 pandemic. So yeah, these simple steps can be implemented at any health facility to improve the early initiation of breastfeeding, which has so many health benefits. And creating awareness at the community level by the government by having a separate column for breastfeeding related issues, right from the antenatal card up to the newborn follow-up card, would go a long way in helping us deal with this issue. So I would like to thank all the staff and the patients and the babies for being a part of this QI and helping us make it a success. This was the token of appreciation given to Niloufer Hospital from UNICEF for successfully completing our QI projects. And I would like to thank you for giving me this opportunity to present my work and also for patiently listening. Thank you.